Inc.? Is this a, what is that a
Ganon.
company that you? Okay, it's a reverse logistics service provider to ensure the proper handling, retrieval, and disposal of expired medicine in accordance with regulatory procedures. To be honest, Mr. President, when I was reviewing, nakita ko yung mga do's and don'ts. I actually didn't know that you're not allowed to throw away expired medicine. So even pala and that often happens in any household na yung vitamins na iniinom, expired na pala, yung what do you call this, paracetamol, expired na, bawal pala. And the reality is, who of us has access to a proper disposal facility? Pupunta ba ako sa ospital para i-dispose yun? I really don't know. So when I was reading it, I was getting nervous because I don't think there's any household that is aware of this proper disposal where we can find
how
them.
do you actually dispose? For example, an expired vitamins, Mr. President, Your Honor? You cannot just dispose it? You have to go to the hospital or?
Kaya nga, ba't tawag yung do ito ng household level? So what DOH recommends for households is you wrap it in newspaper and tape it up so that when it's thrown in the garbage with everything else, it won't get easily punctured or mixed. Because I also read that it could contaminate our waterways, Mr. President. It's not even recommended that you flush it down the toilet. So,
Mr. President,
I think
believe it
there's-
or not, this is the first time I'm hearing this.
like I said, I did not enjoy my review when I read that part because I'm like, oh my gosh, like how much contamination is going on in our country.
And we're only talking about medicines inside our homes.
Well, for the hospitals, Mr. President, if you recall, if you go to a hospital, you will see that they have special bins, no?
Yeah.
And
hazardous,
and then there, because I visited one of those plants in meron sa Cavite ba, tama? Yeah. Yeah, but those are just in the hospital. So I think we can improve. In fairness, even in my visit in other countries, I have not seen information guiding people. But maybe we can be one of the first. Let's have disposal units. If these are just over the counter, baka naman kailangan responsibility na rin yan.
Baka
ng
yun
mga
yung susunod na
pharmacies.
gagawing commercial ng DOH, Mr. President.
Okay daw sila. They can, Mr. President.
Mr. President, again, unfortunately, this is the first time I'm hearing this. Hindi ko alam, Mr. President, kung merong 1% ng ating populasyon ang nakakaalam nito, Mr. President. I hope we do something about it. Mr. President, may we know if DOH employ an automated inventory system for expiry tracking, Mr. President? Meron po ba tayong gano'n? I'm sure it's just a 1+1. Kasi tinanong ko po ito, Ginoong Pangulo, dahil yung COA po continue to cite DOH poor monitoring every single year. If you look at the reports, I don't know bakit laging poor monitoring. Meron ho bang ganon na automated inventory system?
Mr. President, the DOH uses an electronic logistics management information system to digitalize and manage its health commodity supply chain. It's a web-based system, Mr. President.
So namo-monitor po, and who is in charge, Mr. President? May
Who's in charge?
may bureau in charge dyan?
It falls under the supply chain management services of DOH, Mr. President.
Okay. And Mr. President, sa mga nag-expire na gamot, Mr. President, and through the years, sa karanasan ng Department of Health, ito po ba, nakita na po ba natin ano yung pinaka notorious na dahilan bakit tayo na-expire ng mga medicines? Ito po ba, for example, ay because of improper storage? nasisira or dumarating na lang yung time na talagang expired na. Dumating na yung 18 months na sinasabi kaninang average na pagbili ng gamot.
So, Mr. President, in the past, the biggest issue was this was not organized and the ability to track the movement was not there. Pen and paper lang sila, Mr. President. Kaya nga ngayon, the move is to digitalize, Mr. President.
And that gives us the idea kanina na ang laki ng problema ng logistics. Slow moving, overstock supplies. Is that correct, Your Honor?
So, Mr. President, a few years ago, DOH did not have their own warehouses, and it's only recently, in the past few years, that they have their own warehouses, Mr. President.
I'm trying, Mr. President, to just lessen my questions, Mr. President. Every year, Mr. President, and Your Honor would attest to this, that this representation had been raising the issue of human resources of government workers, Mr. President. In fact, perhaps we talk first about our doctors in the Philippines. You and I, Mr. President, distinguished colleague, when we passed the Doktor para sa Bayan law, if you recall, there were only about 3 doctors attending to every 10,000 Filipinos nationwide, while the World Health Organization made a statement that a doctor to population ratio should be at least 5 to 7 doctors per 10,000. So, ngayon ho, Ginoong Pangulo, as per Department of Health, binigyan po tayo ng data para ma-achieve daw po itong ratio of doctors to patient by WHO standards. Binigyan po tayo by 2040 yung target. It is estimated to cost about 3.5 billion pesos for government facilities and 15.3 billion pesos for private health facilities. Pag tinignan naman po natin yung human resources for health per 10,000 population, the Universal Healthcare Act, pet bill po ng ating kaibigan, Senator J.V. Ercito, and the WHO recommends that we maintain 44.5 human resources for health, HRH, per 10,000 population. Now, this consists of 14.3 physicians, 27 nurses, and 2.8 midwives. But in our case, Mr. President, you look at the Philippines, the number of HRH per 10,000 population as of 2023, ang data po ay sinasabi 17.48 HRH per 10,000 population. 17.48. Ang ideal is 44.5 HRH. So, may we know, Mr. President, at this time, if there are improvements in the number and distribution of practicing health professionals nationwide, Mr. President?
Is the question, Mr. President?
The update and as we mentioned of these figures that we mentioned a while ago, may improvement na po ba yung number of and distribution of health professionals nationwide, Mr. President?
No. We still have the same numbers, Mr. President. The numbers that His Honor mentioned, that is still where we are right now.
And what
We still have a shortage.
and what would be the priority of the department to put in place measures in addressing shortages, and perhaps again I am anticipating na we need to improve also yung retention ng ating mga health workers, Mr. President. I recall during the time when we were discussing Doktor para sa Bayan Act, there were only about 4 or 5 regions in the country that are offering in public schools yung School of Medicine. Ngayon po, lahat ng regions meron na. Ang laking tulong ng sponsor natin every year, pinopondohan po ito. But unfortunately, was it last night, if I'm not mistaken, it was last night when I asked the budget of the Commission on Higher Education, parang 14, 15 students per state college university lang yung kayang sponsoran na new entrance for the School of Medicine. For example, ng Cebu Normal University, SP Soto lobbied to double the number of freshman students for School of Medicine. So ito, I'm raising this issue sapagkat naniniwala po tayo na napakahalaga na ma-address natin yung human resources for health, Mr. President.
So, Mr. President, this is the response of the sponsor. We will ask DOH to add to it, no? But because I'm aware of what we've done with the budget, I can respond in that manner. The National Health Workforce Support System, for 2025 was 17.97 billion. The NEP amount is 23.36 billion, and we preserve that amount. So there's an increase of around 5 billion, Mr. President, 5+ billion. And then DOH also has a program where,
The same program, PAC.
no, under this program, sorry, the result of which every municipality has a doctor, Mr. President. So
Every municipality.
Now has a
The target would be when, because I remember when we were discussing the Doktor para sa Bayan Act, there were about 200, that was 5 years ago, 209 municipalities with 0 doctors during that time, if I'm not mistaken, 5 years ago.
yeah.
So right now, what is the number?
Because nagpa-deploy talaga kayo, yeah. So because of this program, Mr. President, it was intentional to be able to put a doctor in every municipality, Mr. President.
So right now, do you have the figures now?
Zero.
Mr. President?
Sabi ng DOH, 0 daw ang munisipyo na walang doktor.
So lahat meron na?
Yeah,
Hindi
it
yan
was
Doktor
announced-
Kwak-Kwak, Mr. President.
Well, it was announced in the SONA, and it was announced in the SONA, and they confirm it, Mr.
That's
President.
good news, Mr. President. That's music to our ears that every municipality.
Hopefully, hindi mag-resign.
Opo, Mr. President. And
Oo. Yeah, I got that. But Mr. President, I'd like to add, no, because my favorite subject matter is really the Doktor para sa Bayan project of ours, the Senate President, His Honor, Senator Joel Villanueva, and myself. We supported the increased increase in carrying capacity of the schools. And we also inquired into the scholarship budget. Ched told us it's sufficient, but I actually had a follow-up if it's really sufficient because we have more medical soaps, and therefore, for every year that there's a freshman year, the following year that will at least double because there's not going to be a sophomore year, and then there's a third year and there's a fourth year, and only after the 4 years will they maintain that enrollment, assuming that they were already full capacity. So every year, actually, until I handle the CHED's budget, I do not handle it this year, we submitted amendments to increase because there was not enough funds to ensure that the incoming freshmen would also have a fresh budget. Hindi pwede yung ganon. Kasi sino yung puputulan mo ng budget? Yung sophomore? Yung junior? O hindi ka tatanggap ng freshman? And sadly, Mr. President, my amendments were approved